Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Mizudin bin Muhammad Yaakob and I'm from 1C. Firstly, I would like to praise to Allah. Because of him, I'm still here. And I would like to thank to our beloved lecturer, Ms. Nohayati binti Muhammad Yaakob, for teaching us on PAD 101. So today I'm going to overview on Ministry of Health and I'm going to discuss about planning on slowing down the pandemic COVID-19.
Hi and Assalamualaikum. So my name is Putri Aisha Aida Binti. My student ID is 2020 8960 and 68. So today I will present to you guys about my part. My part is organizing.
Assalamualaikum and hi everyone. My name is Wan Sumayah binti Wan Osman. My student ID is 2020 481848. I will present to you my part, which is part 4. Decision making.
Hi, Assalamualaikum. My name is Numaisara binti Ahmad Nazri. My student ID is 2020 616388. I will explain to you guys part 5, which is controlling, and the conclusion of this report.
What is Ministry of Health? So, Ministry of Health is a part of Ministry of the Government, which is responsible for health systems such as health behavior, cancer, public health, health management, medical research, and more. The objective of the Ministry of Health is to assist an individual in achieving and sustaining as maintaining a certain level of health status, which is maintaining the welfare of the people in terms of health. The visions of the Ministry of Health is a nation working together for better health, which is cooperate with the other country in exchanging the knowledge for better health service. The missions is to facilitate and support people and to ensure a high quality health system, and this mission still meets the welfare of the people in terms of health. Right, I'm going to continue our discussions on part 1, which is planning. So what is planning? Planning is the first process of management, which is defining the organization goals, establishing an overall strategy for achieving goals, which goals that we are going to discuss later. And last one is developing plans for organizational work activity, which these activities we are going to plan it from. The implementations of the new norms in the society is the plan that we are choose to slow down the pandemic COVID-19 in Malaysia. So this plan is going to refer on strategic and operational plan for long term. This is because the pandemic is unpredictable and we don't even know when the COVID-19 is going to end. So the agency that were involved is the MKN, MS, and MCMC, because they are very very useful for disseminate and control the plan that we are going to choose. And then the objective is kind of clear and possibly to be achieved because it is easy, because we are going to adapting the new norms in the society and keep the society in discipline to new norms.
The definition of organizing can be defined as the process of determining what needs to be done, how it will be done, and who is going to do it. The importance of organizing is to arrange tasks and responsibilities. So, in my report, the Ministry of Health has come up with strategies to solve the issue. Firstly, what the MOH is doing is based on the CRPC, known as the National Crisis Preparedness and Response Center. CRPC is a center that manages and monitors spread of COVID-19 pandemic for the whole Malaysia. Based on the data that CRPC stores about the number of COVID-19, the Health Director, Dr. Noor Hisham, will use information has given by CRPC and will speak to the society to inform them how many cases are going from time to time to provide awareness and precautions to them. Furthermore, MOH will randomly supervise all the premises or public places to check either they are followed the SOP and new norms or not. Who has not followed the rules will get fined. Next, Dr. Noor Hisham also reminded to the people to always operative procedure SOP and the new norms. Also, avoid going to a place of torment if there is not essential need. In addition, take care of people who are vulnerable to COVID-19 such as children, the elderly, and the sick people. Meanwhile, the citizen must obey the instruction given by MOH and together fight against COVID-19. In order to win and free of COVID-19, follow the SOP and new norms provided by government. Whenever going out, mask and massager as a precautions.
Okay, let's move on to another part, which is part 4, decision making. Decision making is the process of selecting a right and effective course of action from several alternatives. The importance of decision making. This is an indispensable element for the organization because without taking the right decision at the right time, nothing can be performed as the plan. The decision making strategies undertaken by MOH. As we know that MOH having problem with the new virus that never been found before. MOH implemented it with physical precaution, avoid 3C, and self-protection 3W, and then use MySejahtera and use media to campaign about COVID-19. The best alternative that MOH take is did the Embracing New Norms campaign in the community. This program has successful to slow down the COVID-19, but if failure, this is because the society not practicing the new norms properly. The type of decision making. This is program decision because it has policy, general guideline, and procedure. The condition of the problem is risk. This is because the virus never been found before in humans, so no one immune with it. And plan began early because MOH learned from previous experience with MERS and SARS.
Okay, moving on to the last part, which is part 5, controlling. Controlling is the process where managers go through to make something happen the way it was planned to be happen. The importance of controlling is accomplishing organizational goals, judging accuracy of standards, improving employees' motivation, and more. The controlling strategies implemented to slow down the pandemic of COVID-19 is first, set performance standards. As part of efforts to address the spread of COVID-19 the MOH has enhanced screening conducted at all points of entry into the country. The placement of thermal scanners at every entry point is to identify the travelers with fever. Second is measure actual performance. All passengers departing from KLIA main terminal will be undergo body temperature screening through the use of thermal scanners before the check-in areas. Only departing passengers, staff, and crew with a body temperature below 37.5 degrees Celsius are permitted to access the check-in areas via the screening point. An individual who is refused entry must notify the respective airline and is advised to go to the clinic or hospital for a health check immediately. Third is compare actual performance with standards. The current situation is going well according to the standards. The spread of COVID-19 can be curbed by doing that strategies. Lastly, take relevant actions. There is no relevant actions taken because this strategy is considered successfully. Finally, we have reached the end. So the conclusion that we get from this study case is this pandemic of COVID-19 really give a lot of trouble in this world, especially in economy and social. This study case also showed that it is not easy to control and handle the pandemic since there's still no vaccine that could be found. The virus also spread easily if people were not adapting to the new norms and rules that were set by the government. By adapting to the new norms, people can avoid themselves from the virus. There are some recommendations that we got to slow down the pandemic of COVID-19. First is, the other agencies should take part in fighting against the pandemic of COVID-19, since this pandemic gave a lot of impact to the country. The second one is, the private sector should cooperate with the government to slow down the pandemic of COVID-19.